The news just broke, yesterday evening, and of course, there've been some reaction. People have actually welcomed the initiative. In fact, it took a lot of people by surprise. That, it goes to show that relations between the United States and Nigeria is being mended, and that things may gradually be coming back to normal. Of course, some people have raised their, concerns over this issue of, dedicating the funds now to faith-based, Christian-based health facilities now. There are some who have concerns with that. But then the issue is this, most of these faith-based or Christian-based healthcare facilities actually provide services not just to Christians alone, but to Muslims as well. So, there's no discrimination at all as to those who access the services of these Christian-based healthcare facilities. And the United States government has come out openly to say, look, what it plans to dedicate to these faith-based health facilities will be somewhere around $200 million. Let's not also forget that this is a core investment, so to speak. So the United States is bringing $2.1 billion. The Nigerian government, of course, will be bringing its own counterpart funding of $3 billion over a period of 5 years. So that's how it works out. So people have welcomed it, and especially after the United States government scrapped USAID. So people have welcomed this, and especially those who work in the area of HIV/AIDS and tuberculosis, that this will definitely go a long way in helping to provide very vital treatments now to those who suffer from these diseases. Panina?
And this comes even as Nigeria tries to resolve a standoff with the U.S. over allegations that Christians are being targeted by attackers in Nigeria. So does this mean that this issue is now resolved?
Well, I think the issues, to a large extent, they've been resolved. Don't forget, a United States delegation was here a few weeks ago. That's from the U.S. Congress. They were here a few weeks ago, and they went around the country, visited a lot of places. Of course, we've not seen their report yet, but it would appear from what we are seeing, the body language of the leadership of the two countries now, we would appear, these issues may not have been completely resolved, but at least they have been resolved. They are no doubt been resolved. If they are not been resolved, it's difficult to see how, for instance, this initiative would come up. I'm talking about this health initiative. Besides, tension is now dying down. We no longer have these strong rhetorics now from the United States government or the U.S. president. Of course, there are still some other concerns, but the Nigerian government, we understand, has given the U.S. government all the assurances that, look, whatever the country is facing, it is going to deal with it decisively. I'm talking about insecurity. Now, we've seen the government in the past couple of weeks now scale up its, operation against banditry, Boko Haram, and what have you. So we're seeing the military move against these bandits and insurgents. I think there's some level of reassurance now from the Nigerian government to the U.S. government. And so that tension is no doubt dying down. And if you ask, I think for me, the issue is definitely been resolved. Maybe not completely, but to a large extent, it's been resolved. Panina?
All right, Deji, thank you very much for that. Deji Bademosi, live for us there in Lagos. Now, for a closer look at how this agreement will impact the healthcare system in Nigeria, we earlier spoke to Professor David Awurawo, an expert in international relations at the University of Lagos.
Well, the position of the United States to deal with government directly to address some social issues across Africa is welcome. It is welcome because it has the capacity to improve the quality of life across Africa, and that is what everyone desires. A stable Africa will contribute to a stable international community. So it is also in the interest of the United States that it is doing what it is doing. And, the shift by President Trump means that the future is bright for America's engagement with Africa. The focus on health, first of all, is important. And the diseases they have identified to tackle, tuberculosis, HIV, malaria, these are diseases that have posed problems and led to many deaths. And so the funds and all the materials that will be available to address this disease in the next 5 years will certainly reduce number of deaths and contribute to a healthier life for Africans, I mean, of course, Nigerians in this context, because, of course, some of the African countries, so like Kenya, we understand, have also been included in this. And so it's welcome, but I'm not sure how the implementation will take place, where Christians will be identified and treated specially, or maybe Christian organizations, will be targeted. I don't know, but I would have preferred a more open thing that will enable everybody to benefit, because in the areas across Nigeria, areas where these diseases have been, prevalent, are not even where Christians are, predominant. So I would have expected something that is broader, that is all-embracing, that accommodates everybody. In bilateral diplomacy, there are multiple layers. Countries can have problems at some levels, disagreements at some levels, where progress is being made at some other levels. So it is not surprising that despite the disagreements regarding whether Christian genocide and the rest of them, progress is being made on the social field, in this time health. So, I mean, and if progress is made along this line, it also has a way of reducing tension in these other areas where, there are disagreements. So it is not surprising. It is just that people are a bit, a bit not comfortable with how to explain it, but it is very easy to explain, considering the fact that there are multiple layers of interaction in the international system, in bilateral diplomacy. So even when problems or disagreements, take place at the level of security, politics, progress can be made at the level of the economy, social cooperation, and the rest of them. And that is what has played out in this regard. And like I said before, it is positive.